Well, every woman wants to look fantastic on their special day, and if you suffer from unsightly varicose and spider veins, there's help to lessen their severity. And Dr. Jeffrey Alpern is a cardiovascular surgeon, vein specialist, and the first DO to perform a heart and heart-lung transplant in the world. And he is joined by Dr. Kersten, a double board-certified OB/GYN medical specialist in the diagnosis and treatment of venous disorders. Boy, thank you so much for joining us. This is such an issue that so many people don't understand, and it can really lead to some serious medical issues. So, Dr. Alpern, let me ask you first. Kim Kardashian recently gave birth to a healthy little baby girl, but a lot of concerns were that she wore tight shoes or really high shoes, and that it could lead to spider veins and venous disease. Is that true?
I would agree with that. There's many reasons people develop varicose veins: pregnancy, genetics, people that are on their feet for an extended period of time, trauma to the legs. When we walk, our calf muscles squeeze the blood out of the veins to return the blood back to the heart. And veins have valves in them. I call them one-way doors. And if the valves are not working properly, some blood goes up and some will come back down, and patients will start to see things and feel things. When women wear high heels for an extended period of time, the pumping mechanism in the calf muscles doesn't function optimally, and this can increase the pressure in the veins, and then that can affect the valves.
Do you mean extended period of time is in terms of years or hours of the day?
Both.
Okay, all right. Well, Dr. Kersten, you've practiced obstetrics for years, but now you're focusing on venous diagnoses and disease. Why? Why was that so important to you?
Well, I had done OB for about 31 years, and I was frankly getting a little bit tired of the call hours, and the malpractice rates were an issue. I had an opportunity to study a little different branch of medicine. I wasn't quite ready to retire, and I went into phlebology, or the study and treatment of venous disorders, especially of the leg. During my years in practice, I'd seen a lot of pregnant ladies that had swelling of the ankles, got large venous disorders in the legs, and there wasn't a satisfactory way to treat it. And it was kind of exciting to transition from one specialty to another and be able to pick up ways to treat venous disorders.
Right, because, you know, it's unsightly, but people don't realize that it can actually lead to heart, disease and all of that. What can pregnant women do to eliminate or alleviate the spider veins?
In pregnancy, we like to evaluate the patient to find out how severe the condition is. Many of the treatments can probably be done safely in pregnancy, but they're not fully approved, and we're a little bit reticent about doing them in pregnancy, but we can get the patient fitted for compression hose and make arrangements after the pregnancy is over to have the patient come in to follow through and successfully treat, so we don't have long-going problems.
Great. And Dr. Alpern, after pregnancy, what are the treatments, and what's the best strategy?
Well, every patient that comes to Vein Specialist of Arizona undergoes a complete venous duplex or ultrasound. It's a non-invasive sound wave test, and it determines whether or not they have a problem and where is the problem. All of our treatments are done as an outpatient facility. Patients are done under local anesthesia, no incisions. They can drive themselves home. And the treatment modalities that we offer is heat, which either can be radiofrequency or laser. We're putting medicine into the vein, which is called sclerotherapy. All these goals are to remove the abnormal veins and let normal veins take over the function of returning blood back to the heart.
All I can say is it's a lot different than it used to be, much easier now. Dr. Alpern, Vein Specialist of Arizona, you're holding an open house tomorrow, so tell us about the event.
We are, and our staff will be there to give tours of our facility. We're going to have a raffle for free spider vein treatment, and we'll have food and drinks, and it'll be a fun time. So anyone can just go to our website, veinsaz.com, and get more details.
Very good. Thank you both for joining us today.
Thank you.
Really important information. And for details, everyone, just visit Vein Specialist of Arizona website, veinsaz.com, or you can call the number on your screen. And